to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We've got some folks here tonight. Do we have any public comment? Anything that needs to be brought up? Okay.
Would all of you sign the sign-in sheet, please?
Yes.
Good, thank you.
Okay. So the public will watch us very intently as we go forward. Next item is the consent agenda. Have you guys had a chance to read the minutes from the last meeting?
Yes, and all three present have signed.
Okay, so Ken and Shireen are not here for the calendar, but
I so move that we accept the consent agenda. This is John.
And Gerald seconds it.
John has moved and Gerald has seconded to the approval of the consent agenda as presented. All those in favor?
Aye.
Passes unanimously. Okay. Now we get to the meat and potatoes, the May 22 financial report. Ed, you're up.
All right.
You can move them
Oh,
around.
Thank you.
Yeah, that should be the June
It should
report.
be June, right, Ed?
Yes.
Okay,
That's
sorry.
why when I listed as May, that was my mistake.
Okay.
June, sorry.
Typo, we'll put
We
it
don't
in
want to,
June.
we don't want to have a May again.
No, God, no.
May was pretty bad.
It's, so this is the financial report for Lake Health District for June 2022, which is the 12th period of the year, or fiscal year FY '22. We're going to start off with patient count. Acute is 383, an increase of 55 over the previous year. For clinics, it was 1975, a decrease of 6 over the previous year. Other outpatient services were 5,433, a decrease of 232. That's mostly lab, almost 100% lab, and maybe 1 or 2 radiology visits. That's what the difference was. Overall, for the month of June, I had 7,791 visits, a decrease of 183 over the previous year. But year to date, it's up 10,238 to 91,140 for the year. So almost 100,000 visits. That's pretty awesome. For gross patient charges for June, it was 4.6 million, an increase of 34,000 over last year. And year over year, it's up about 4%. That's something we're going to dig into in this new year. For collections, for the month of June, it was 3.1 million, an increase over last June of 50,000. So, and year over year, it's up 5.5 million, or 19.38%. Days cash on hand. For June, we had cash on hand of 41 days, 55 less than the last time this year, this time last year. But we averaged 81. So we have a higher average overall, but still concerning. Monthly net income for June, we had 4.6 million in gross revenue, less revenue deductions of 1.3 million. Less expense of 3.4 million, and then plus 300,000 in non-operating revenue and expense resulted in a deficit for June of 165. It rounded up. On this year-to-date profit and loss, it's actually, you can see where that we spent the grant in May and then we billed for it and recouped it in June. You see that 282 number? It's to the positive. So, or I'm sorry, where the grant revenue and expense, it nets out to be 154 positive. That was that equipment for EMS and the training. Year to date, total revenue of 35.3 million, less operating expense of 41.2, and then the total non-operating grants and other things, 6.6 million. Net surplus year to date is 1.1 million, or 1.0 million. On the balance sheet, total assets of 44 million, total liabilities of 39.2, fund balance of 4.8, and then as you can see, there's a reduction in cash for the month of June of 856,000. That's all I have for Lake Health District today.
Okay, well, going forward, we hope to see a little bit less in revenue deductions and a little bit,
Yes, and we're kind of really digging into that, because overall in the revenue deductions, it's broken out at about 19% is contractual, and we really just have to hold the insurance companies to a higher standard to make sure they're paying us correctly. Charity care makes up about 3%, and then about 5% is the admin write-offs, and that's everything from credentialing, timely filing, or not getting the prior authorization. So that's
so
something
the
we're.
admin write-offs are something that are in our control.
Yes, and it's
Okay.
something we have to hit hard and put processes in place so we don't miss out on that opportunity.
Because 5% is a huge number on the overall.
Yes, it works out to be almost 2.5 million, and that's not okay. So
Okay.
we are putting things in place to prevent that.
It's a heavy lift, but that's what
Yep.
we have to do.
Yep. That's the admin side. And then on the expense side, we're looking at maybe some savings without the travel nurse issue,
Yes.
kind of phasing that in as we go over time, correct?
Not very much phasing in. It's gonna happen very quickly. So we can talk about that in a bit.
Yeah. I think September is the biggest change in that.
And we can see our cash flow is
Yes.
still going the wrong way, and it's untenable, so we're looking to you guys for some solutions.
And I think now we're making them data-driven as far as how these decisions are made, so that we know the real numbers and.
And you're pulling in other members of our team in each silo and pulling them together and saying, okay, let's look for some ideas.
Yes, absolutely.
Good.
Oh, I'm sorry.
Okay, go ahead. Lakeview Gardens.
All right, so Lakeview Gardens and Lake Health Medical Supply. For the gardens, the revenue was 262 in June, expenses were 540 in June, which resulted in a deficit of 278. So we don't see those things that I've been, touting about, the 76,800 in contract labor that was saved. That's actually reflected in July. The other thing too that Charlie had brought up is the bed tax, I think, or because of our high Medicaid population, there's a recoup that's
There is a
possible.
recoup. Will we get the full 150 grand back, or is it prorated?
By quarter, they
Yeah,
It is paid by quarter.
Oh, okay.
so I haven't got a response yet. Everybody's trying to shoot in all directions, I guess, because the enemy's all around us theoretically, so I hope to have some closure by Monday or Tuesday.
Well, if we're surrounded, then whichever way we shoot, we're going to be winners.
Absolutely. That's the best part of all this crunch.
Good thing
Holy
we
mackerel. That's
Yes.
an analogy I hadn't thought about.
But yeah, it's, and also for Lake Health Medical Supply, for June, it has revenue of 42, expenses were 33. which
Could you
is
go back to that last slide?
Yeah, sure.
That's good, thank you.
For Lake Health Medical Supply, revenue 42, expenses at 33, resulted in a surplus of 8,000, and then year-to-date, they're at 104. We have exciting news in Lake Health Medical Supply this month, so. And that's all I have for the financial presentation.
Okay. Thank you, Ed. Any questions? Okay.
I didn't get what our contract labor cost was for back up to one.
So yeah, it didn't change much in the month of June. I think it was the July 5th meeting or July 7th meeting that said, you know what, we're gonna do, this is gonna be our first action. So it'll be reflected in July.
Okay.
So things will start,
Yes,
okay.
and they're just not renewing.
Well, we don't have, the government is not going to come in and save us like they did with the payroll protection program, so we have to live with what we've got. Hopefully, there'll be a change in the way we're reimbursed, but it's not looking good for the short term, for sure.
No, we have to do more with less.
Right.
It's
Yeah, short
really
term,
good.
we've got to make changes.
Yeah.
Absolutely.
I'll be happy to talk a little bit about that in just a bit.
Okay, thank you.
One thing I didn't get a chance to talk to you about in the finance meeting earlier this week, but EMS, we keep hearing it's going to turn around, we're going to start making money. It's at $158,000 loss this year. And it just doesn't seem to happen. It's just losing money every month, so I hope you two guys can get together and get this figured out.
Yeah, we've been driving that. It actually made a $27,000 improvement from June to July. In
Obviously,
revenue.
July, yes.
I know, that's the problem. We're looking ahead and we're reporting behind, which is unfortunate. We're gonna try to fix that this year.
Right, the reporting going forward is, based on the past, but we've got to have better information going forward.
Right, and so, just as an example, and this is just super high level of round numbers, but say, if he calculates the charges, his charges, what, all the ambulance that ran, all the services that were given were $151,000 for the month of July, and we're only collecting $78,000, we gotta know what's the breakdown,
Right.
is it,
But our revenue's been, up till June, has been only about $60,000 a month.
right, and now it's finding that gap and fixing it. We raised all the rates in July 1st, to be comparable with Willamette and different other areas. I mean, gas costs a fortune now to run those big diesels, so it's been adjusted, and I think July you'll see the biggest difference, but August they're gonna knock it out of the park.
I look forward to August.
I think their revenue should average about 110 to 130.
That would be almost double.
Yeah.
No, that's what we're missing. That's the thing we're missing. Certain services that they're providing are not getting captured. So it's just drilling down on every little thing,
Stay on it.
Did I see?
Yeah, no, there was definitely some holes in what we were billing for. We weren't billing for transport's fare link out to the airport, which is a pretty significant bill.
Can we go back?
We're waiting on their attorneys to look through the contract that they sent us, that we have signed and set our rates, and we'll try to go back and bill from November 1 until now with that.
So it's
That
like,
would be great, but going forward, we've got that whole plug, right?
Now that hole is plugged, as well as our rates being comparable to Klamath County Fire District 1, as well as Basin Ambulance down in like the Tule Lake area and the Merrill area. So those were pretty significant increases in rates, along with some stuff that we weren't billing for here locally as well.
good.
Okay. Excellent, thank you. Okay, any other questions? Nope. Okay, moving forward, Dr. Chang is not here, but medical staff report, do we have any additions?
They didn't have any, they will next month,
Okay.
but they didn't have any major issues that they were going through. There were some operational things in discussion, but they did not approve any new applications.
Thank you. Nursing report. Tori, you're up.
All right. So staffing is our focus, and as Ed and Charlie have said, our traveler staff in acute are starting to phase out as their contracts end. So currently I've got 3 leaving this month, and then a larger number, I think 4 or 5 in September, and then finally 2 early part of October. So in the meantime, looking to compensate for that loss. Actually, 2 of those travelers are going to apply for PRN positions here, which is great.
Okay.
They really like it here.
Good.
And despite the cut in wages, they'll do other things, but want to stay in contact and want to give us some of their time. So that's a win. I think one of them is going to apply for a full-time night shift position, which is huge. So very happy we were able to capture her. while we had the travelers here, we were able to get 7 of our regular staff RNs certified in either OB or ER, which helps them broaden their base of patient care, who they could take care of. And it was one of the reasons we needed travelers, was to cover those more critical care areas.
That'll help you schedule too, will it?
Yeah, so we've made up for that in getting the expertise of our nurses.
Do you see any reduction in services due to the change, or is this going to be something that's going to be controllable?
Well, I'm eternally optimistic, so I would like to hope that we can maintain our current staffing. I think it's inevitable that there might be some need for some adjustment. Right now, we have the staffing as such that we have a charge nurse essentially who does not take a patient assignment and is just there to kind of help out and troubleshoot as things go on through the shift. That person will likely need to take patient load to help compensate, but we'll see. You know, the other thing, in addition to these travelers who are willing to stick around on a per diem basis, a part-time basis, I got one full-time CNA that we've extended an offer to. We've got our 3 Lakeview KCC cohort students who will start in September and hopefully become RNs that will stick with us. They're all local residents, pretty ingrained into the community. And then of the CNA class, 5 of the 8 graduated from that and are helping over in long-term care right now. So I think, you know, overall, we're trying to pull in some community folks and some regular staff to help make up for this.
Well, that's work.
Appreciate the work you're doing, I really, yeah.
Thank you very much.
Not easy.
No.
What is our census now in long-term care?
In long-term care, I believe is it 13 and 12?
What about acute care?
In acute care right this minute, we're at 12.
What were we on Tuesday?
On Tuesday, we were at 15 with a baby due, so.
And Monday,
Monday, we were at
18 or 19?
It was 19 actually, yeah, 19. So actually, today was our dip in the week, but, yeah.
Does that include swing beds?
It does,
Okay.
yes.
Okay, any questions? Thank you, very good, Kari.
Thank you.
Appreciate it. Lisa, did you have anything to say before I get Charlie involved?
Yeah, we've had an exciting month in the clinic. So our rural healthcare auditor showed up unexpectedly early last week and went through all of our policies and procedures and the hospital's policies and procedures. And she will let us know the findings in about 2 weeks. So that was exciting. We also are taking an active role in helping with the revenue stream. We have pulled under our umbrella 2 clinic billers and a credentialer. So that'll help keep us on top of these, you know, credentialing the providers, making sure they're in with the insurances and we have the contracts correct. So that's what's going on. Our MAs, we have how many MAs? 2 or 3 that are studying to be certified at this point, and they're great assets to the clinic. And surgeries are booming and specialties staying busy.
Are you staffed up? Or are you staffed up?
We're down 2 MAs. We just had 2 resignations in the last month. So we are looking to hire for 2 more MAs. And still hoping for providers. We had a nice interview with Dr. Long, and Charlie may know more about that, but she seemed to like the area. Keeping my fingers crossed.
Our admissions process going well with the paper trail and all of that, with the computer trail, I should say?
It is, so we audit that a couple of times a week, the front desk, because the revenue stream starts at the front desk.
Starts right there.
Yep, so we are auditing the ladies and making sure they know if they made mistakes where and how to fix them.
Okay, good.
So we're staying above 82% on average.
Okay.
Some days it's 100, some days they make a silly
Who gives you a
mistake.
target? 100% is the target.
We are reaching for that.
So,
But we also have in place a way to fix that when it's identified by auditing
okay.
that. So our clinic trainer goes back and fixes that so that downstream it's in place for any other billing.
Good, because that ends up in receivables later on.
Correct.
Okay. Tyson, do you have anything to add, or you're?
Nope, not that I can think of, unless you want me to talk about the disaster and stuff.
Why don't we just turn it over to you, Charlie, and go ahead?
We'll get there when we get there.
Yeah.
There are a lot of things going on, so I want to talk about some of the good, some of the challenging, and how we're addressing them. One of the great things we have, and I hope everyone, as they walk into the acute care, they walk by the picture of all the nurses and all the great things that our nursing staff are doing. This month, Tori didn't crow about this, but it's a pretty exciting. Megan Cruz was selected as an Oregon's outstanding nurse proctor, or preceptor rather. And that's a pretty darn big deal. So as part of our program with Climate Community College and Oregon Tech, where the students are here, Megan is in the OB department, and so she was highlighted as one of the top stars in the state. So that's pretty
So
exciting.
what's a preceptor, what does that mean?
So that means when students are here learning, they need active nurses teaching them. And so they're precepting and teaching them as they're going. Is that right?
Yes.
Good. So that's pretty exciting. We did have an excitement with the patient-centered primary care home audit. It comes every 7 years as part of our rural health clinic. And we did pretty well. That was pretty exciting. We also had in our medical supply company the audit that comes every 3 years, and they found 0 deficiencies. They said it was extraordinary. So they were very, very pleased on how well that's going. So that was a really good thing. So we have lots and lots of things that are really positive that are happening. One thing I'd like to talk about, before we get into some of the tough stuff, is I sent to you a report about our grants and the amount of grants that we have. Did everybody get a chance to look at that, or?
Yes.
So I think it's important to understand that in a relatively short time period, as you can see, we have $2.6 million that is coming from outside of Lake County. And these are not grants that are in the past. These are current grants that we're dealing with. And so a lot of times, when we apply, and we've got a great team that applies for the grants, supports the managers that are trying to deliver the added things that these grants pay for, and then the team has to follow up and make sure that we do that properly and report back. You may have heard me say before, in order to get grants, you got to do what they ask you to do. When they give you the money, you have to do it. And if you do it, they kind of like that. We'll give you more money. So the fact that we are now in 4 or 5 years up to $2.6 million, and we have another grant coming that we've been advised that we're going to receive. We haven't received it yet. But I wanted to give you a couple of ideas of the kinds of things. So you'll see this grant right above here, $200,000. That money came specifically for our EMS service. And maybe you could say a little bit about what we've done with it and where it's going.
So that grant allowed us to purchase new extrication equipment and put all of our full-time staff as well as our volunteers through some vehicle extrication training. It's allowing us to provide new protective equipment for when we do have motor vehicle accidents and vehicle extrications. It's also part of what allowed me to do the Operation Prom Night scenario. It was all looped in there. I noticed at the bottom it says we requested the no-cost extension. We actually ended up getting that no-cost extension to February 28th. With that, all of our paramedics will be taking a critical care paramedic course to be certified to take critical care transports by ground out of the hospital, as well as we've taken, we actually have three classes scheduled for ASSIST, which I believe stands for Applied Suicide Intervention Techniques. I'm not sure what the second S stands for, I can't remember off the top of my head. That basically is the same training that the suicide hotline folks take. It's used to de-escalate the situation, find them a plan to get through the evening until we can get them into the wellness centers, essentially how we're utilizing that. Instead of traditionally, and what other counties would do is they would put them in what they call a POH or peace officer hold and then drag them into the hospital. We're trying to avoid that at all costs. Tomorrow, actually, I believe half of my staff is taking another course called Mental Health First Aid, which is also designed to identify those early on, those risks for suicide, substance abuse, and such, to try to help the community and try to take a little bit of the load off the wellness center, or to work hand in hand with our wellness center to try to take care of mental health in the county.
What is your staffing level now, Tyson, and are you up to speed on that?
I have 2 students that still need to pass their written exam for their EMT course that they completed. They passed their practicals, and if they do and they apply to stay with us, then I'll be at full staffing with a paramedic and intermediate and 2 basics per shift, which came in fairly handy. Just a week and a half or 2 weeks ago, we had a patient that needed to get to Bend fairly rapidly, didn't have time to wait for AirLink to get down here, because that whole process to get AirLink down here takes about 3.5 hours for them to get through the process of finding a bed, finding the aircraft, getting the aircraft here, us picking them up at the airport, bringing them back over to the hospital to pick up the patient, and then going back to the airport. With that, Abby called me and said, hey, we have this patient that needs to be in Bend for surgery immediately. How fast can you get on the ground? And I just said, how fast can you have the paperwork ready? Because we had full staffing to be able to facilitate that just that quick. And so I think that patient was out in, what, 20 minutes?
Very quickly.
On the road.
On the road in 20
That's
minutes.
great, that's pretty important for our county.
Yeah.
How many runs did you say you had just the other day?
We had 4 on Sunday. We ran a total of 53 runs in July, and I believe we took 6 ground transports, and the hospital only ended up flying out 5 patients that month. So our ground transports are continuing to go up, and our flights are going down.
Which is a huge benefit to the community.
And it's a savings to the patient.
It's a huge savings to the patient, yes. So that's an important thing. There are lots of grants up here. Some of them are very time sensitive. We have a couple or several grants that we have to have the work done before the end of this calendar year. And so we were able to get an extension for this large grant that Tyson talked about. Some we still are in the process of getting approvals from these organizations. What makes it a challenge is getting a contractor to do some of the work. We have, in talking to the contractors, could you get the work done before the end of the year? And their problem, of course, is finding subs. So we're trying to get it done, and of course, weather is going to be coming soon. So, but we have received a great deal of money. One of the big grants that we have been granted by the Oregon Health Authority is for a burn that you can see in the center, the Behavioral Health Resource Network. The legislature designated $100 million for all counties. They divvied it out by population and by homelessness. And so we received the $1.2 million, we have to spend that between now and December 31st, 2023. So we have 18 months to figure out how to deal with that. Part of that responsibility is to deal with a housing issue. And so the state allocated another $100 million to be dispersed throughout the state. And we will receive about 1.3 or $1.4 million for that. What we've asked, since all the counties that are trying to deal with this, is a large portion of it to be used to help plan this. What are we going to do? How do we thoughtfully go about spending the money? Because that's a lot of money, and the state isn't even clear yet what we're supposed to do. So they've got lots of trainings, and everyone's got lots of questions, but every county is experiencing the same thing.
So can this be actually used to build housing?
Some of it is to build, but of course, you can't build it in 18 months. You can't plan, put it together, and get it built. Some of it can be used as rental assistance. I mean, there's a variety of different criteria on how it can be done. But they're sort of writing the rules as they go.
Well, once this money comes in and then is spent, what do we have? We've got continuing expenses to carry the program forward?
So what the state has said is a great deal of the money is from the marijuana tax. And they believe that there will not be fewer people smoking or imbibing in marijuana, so that they think the tax dollars will keep flowing. And this will be an ongoing support, financial support. So if we were to buy or build something, and then there'd be operational costs, maybe not this amount of money, but they don't know how to predict it. It's a challenging situation to do. But there are many different topics of grants that we are dealing with. I received notice today that we received another grant of $5,000 to try and look at some of our patients that are at moderate risk right now. And if we can we've been able to identify them based on research that our quality analysts, and you'll hear from Elena next month. She and Abby are going to come and talk about some of the work she's doing, as well as a focus on stroke that they have been dealing with, and how we deal with stroke patients as they are occurring. It's pretty astounding stuff, but they weren't quite ready for it today. And so she will be getting, we'll get about $5,000 to try and look at patients that are at moderate risk and keep them from becoming high risk. So lots of really good things from a planning standpoint. I just want you to understand that many of the things that we're able to do are not necessarily coming out of district funds. When you see $2.6 million, that's a lot of money coming from outside, and it's benefiting that community. And it's being handled by lots and lots of people within the district. One of the things that we have done we have a big issue with our travelers. We love them, but it's a cost that we cannot afford. And so, as I talked about before, the process of just canceling their contracts. Some hospitals have done it, and there's been challenges with that. For us, one of the big issues is if you cancel a contract, they expect you to keep paying for it, even if they're not delivering service. So that's why we have graduated this process. As Ed talked about the savings in long-term care, one of the things that we are doing is we are consolidating patients into one house and not having both houses open. Everything happens in time. We don't just kick people out and move them without their approval. We have to get everyone's approval, but we're able to do that. And we will limit the number of people we can take going forward until we can find staff. We have some think we have 5 of the 8 CNAs that took the class, have passed their test, and they will become licensed within, well, hopefully before October. There's a certain time period for when the state finally authorizes them as not just nurse assistants, to become certified nurse assistants. So they're, we don't have an exact date. That will help us in dealing with our staffing and enable us to potentially add more patients. But right now, we will have to limit that.
So Charlie, you might expand on, so there's 3 buildings over here.
Right.
And could you explain what is one assisted living, and then there's long-term care, and
Yes.
and one, and what's the other one?
So there are 2 buildings that are long-term care, and 1 building is assisted living. The assisted living building is full and has 12 patients in it. We have 13 patients. We have there's still some movement of the people from in the Plum House, Wild Plum, which is in the middle, into the other house. That will happen in the next couple of days.
So then we'll be closing that house temporarily.
We will not be adding patients. Okay? So we don't close it. It sounds like you're boarding it up. No, we're not doing that. But we will not be having patients there. Now, if we have the staffing, we will be able to add that. Okay? In talking with the state about the Oregon Health Authority as well as Department of Health and Human Services, DHS, I've talked to them a great deal about our financial situation, and I'm pleased to say that I received notice yesterday that they will be providing us a grant of $500,000. We should have that money by the end of next week. That's I asked for more, but...
Where's that coming from, Charlie?
It's either coming from Oregon Health Authority or from the Department of Human Services. It wasn't clear. It's from the state.
And that's earmarked for long-term care? Or is it?
It is for the long-term care and assisted living. I've asked for additional assistance. They are aware of that. And the state, I can talk about my activities outside of Lakeview to try and deal with this.
Are there any letters or anything that the board can do to help you with that at the higher level?
That might happen. Let me go into that. Last week I was on 2 phone calls first with the leadership of Oregon Health Authority and the Department of Human Services, as well as senior leadership from all of the major hospital systems put on by our association. And we talked a great deal about the challenges that hospitals are facing in the state right now. To put it into perspective, and this has been talked about not just here, it's happening everywhere. In Portland, hospitals are so full that they can't accept new patients. They may have travelers, but they have more patients than they can handle. Salem Health, for the first time since 2008, they are having to divert ambulances because they don't have the capacity to take patients.
Where are they diverting to?
To Portland or to Eugene or elsewhere. I think Tori said that she got a call last week
Yes,
from Salem Health
yes.
asking if we would accept one of their ICU patients. Is that correct?
That is correct. And when I told them we weren't licensed to take ICU patients, they asked if we could accept any medical patients or telemetry patients, and that was one of the days our census was very high, so we weren't able to. But I was astounded that we were getting phone calls from that far away looking for bed space.
Wow.
On the calls that I was on, one with the leadership of Oregon Health Authority and the state people, the governor's office was also involved in this. And then the second call was on Thursday, a week ago today, with our representatives There were 70, both representatives, senators, and their staff, as well as several hospital representatives talking about the challenge that everyone is facing. We've had to send patients as far away as Boise because we can't find beds. This is a real challenge that the state is experiencing. Not only are we experiencing it, the state of Washington is equally in a similar situation. So if we think we can send patients to Seattle, they're trying to send patients to Oregon. So what is hard for all of us to understand is with this enormous occupancy and therefore capacity problem, this is the summer, and this is not our busiest time of the year. People are often sicker in the colder months. So we're anxious about how this will proceed. Part of the reason that we have this capacity problem is staff. There aren't enough staff, and we've relied on the travelers. Well, the travelers' cost is untenable, and as a consequence, most of the hospitals are saying we just simply cannot afford it. So we're just going to have to say no, which is what we're doing, and which many of the hospitals are doing. Another problem, of course, is that at any given day, right now, there are over 500 patients sitting in a hospital, especially in the Portland area, and they can't get into a long-term care or post-acute care facility. So we think of it always as long-term care, but if a person goes into a rehab facility, or if they go into, they had a stroke, and so they go into a stroke care facility, it's not all just long-term care. They can't get in because the long-term care business can't find staff. So that's part of the exacerbation. And of course, what makes it very challenging, it's been reported that all of the hospitals, or virtually all of the hospitals in the first couple months of this year have lost money. All the hospitals. So here we have extraordinary census, and we have costs largely because of this demand for travelers, and we can't, it's not sustainable. So we're doing a lot of things to address that. Number one, we got this grant. We were able to do some refinancing on some of the equipment that we have purchased, and it's roughly, how much is it again that we're refinancing?
498.
It's about $500,000 that we're, instead of paying cash for, we're leasing it, so we'll get that cash back and pay it over time. In order to eliminate the need for the travelers, we will start reducing some of our swing bed patients. We have to do that so that we can accommodate. Once we get better staff, better people that are willing to work for us, then we can start considering that. But our first and foremost interest is to take care of our sick patients. And that's what we're going to continue doing. We think we have a strategy to address this, and we will go over that a little bit more in detail. It's a moving process. So rather than say this is what exactly will happen, be assured we have a plan, and we're going through that. I'd rather not go through all the details right now. We did interview Dr. Wong, excuse me. She's a family practice doctor that is in Alaska and is interested in coming here. She's got some challenges, so it's not going to be overnight, but we're very excited about the prospect of that. We've engaged another firm to help us find a replacement, and they're actively looking and already gave me a name of a physician to consider. Not quite found the right person yet, but we're working on that. We do have one disappointing thing, and that is Kathy Thompson, who's been, as a physician assistant, who's been with us for a long time. Due to family reasons, is going to be moving to Corvallis in September. So that will be a loss for us. We're continuing to look for others to
She's a
help.
nurse practitioner?
She's a physician assistant. Yes. But it, sometimes families, circumstances change and these things happen. We are continuing our negotiations with the Oregon Nurses Association. We began, we started back in June, and then we again met in July, and we will meet again on the 16th and 17th of August. So we're getting close. As with all negotiations, it's an up and down. It evolves as the time goes along. Do I have anything? This is probably not the time to talk about it, but I would like I'd like your input. I sent you information about our educational assistance program. It is, it's fairly well thought out. We talked about it a couple of months ago. Now we're getting down to how much do we spend. And as you can see, the requests very quickly can eat through all of that grant money. So when you have time in the next week or so, because I have students that have asked if they could access that assistance.
I think there needs to be some thoughts and maybe some changes in that. I've had a chance to go over charting.
Perfect, and that's the reason I sent it to you, is there are a lot of questions, and I want to be able to thoughtfully review that. But this may or may not, unless you want to talk about it tonight.
No, I think the existing program made some changes, but I don't think we're ready to discuss it yet.
Okay. But we do have some, there are several students, our relationship with Klamath Community College still calls for students, and I think we have 3 that are starting this fall. And all 3 are very interested in what we can offer to them. So it's an important issue, and I want to be able to try and address it. And we've been trying to come up with numbers on this, but there's just been many things going on at once. So I apologize for the timing, but we want to be
But it's an
thoughtful.
incentive for them to stay in this community.
Oh, my goodness, yes.
Important.
Oh, yeah. And there are a lot of things going on in terms of how we incentivize people that are in our community that want to work in the healthcare field. And these are great opportunities. I think Klamath Community just got approval for their LPN program, is that correct?
That's correct.
I understand it correctly. So CNA, LPN, RN, these are huge opportunities. And the people that, I think we have done, with your assistance, we've done a lot for people in our community to learn and then give, to provide care in our community. And we have an obligation and an opportunity to keep doing that. So I think it's exciting. It's not cheap, but it is good for us. Other than that, it's been kind of slow.
Okay. Nothing from the public, so at this time we'll go ahead.
Is there anything that you would like me to bring up in public, that public meeting that I can talk about? Anybody has any question about? Because sometimes I've said the same thing more than once, and I forget who I said it to.
Nope, I think.
Old age, maybe.
Okay, we'll go ahead and go into executive session under ORS 192.6 60, bracket 2, bracket A personnel, bracket C medical staff, bracket D real estate, and bracket H legal. And,
It's gonna stay.
Pardon?